That brings the total number of people who've died in the UK within 28 days of a positive test to 71,109. Let's speak to the GP now, Dr. Patel. Good morning to you. First of all, tell us what the last couple of weeks have been like in terms of administering the vaccine.
Good morning, Gillian, and thank you for inviting us. We've seen some incredible work and dedication by the administration teams, managers, volunteer sector, and frontline clinicians, especially in primary care, in delivering the vaccine over the last 2 weeks. And we've heard from NHS England that we've delivered over 520,000 vaccines in the first 2 weeks, which is absolutely incredible.
So in your estimation, it has been a success. Yet we read this morning in the newspapers that we need to at least get up to 2 million a week to avoid a third wave.
So I would say it's a success in the fact that we've been able to mobilise so quickly, but you're absolutely right. We know we need to ramp up the number of vaccines being delivered, and this is a stretch on the workforce currently with the normal work that winter pressures bring, the flu vaccination programme and everything else. And this is a lot for our colleagues to take. They've already been stretched during the last 10 months, and the sustainability of this is something that we're not sure how we're going to be able to continue this over the next 10, 12 months.
What are the exact pressures? Is it that more staff are needed to help carry out the programme?
Absolutely. So to ramp up to the potential target of 2 million vaccinations a week, we definitely need more staff. We need time, resources, and we have to remember that we still have patients presenting with all their normal conditions. We have the flu vaccination programme that's been extended. We have the normal winter pressures. And as we've just heard from your colleagues, hospitals are full at the moment. So we've got all the current pressures that we normally see during winter, increased with the COVID pandemic, while asking colleagues to do extra work to deliver this vaccine.
And are you able to devote enough time to patients with other concerns?
So I know that our colleagues are working around the clock and putting in extra shifts to continue business as usual during the winter and deliver the vaccine. The question comes really on how long this goodwill and dedication can survive over the next 10, 12 months on a stretched workforce who have already suffered both physically and mentally during this time.
Now, I'm not sure if you can answer this question, but a lot of people wanting to know if they've already had COVID-19, can they then subsequently catch this new variant?
So that's a difficult one. Having had COVID-19, the idea is that they would have built some antibodies. The difficulty we are having is we're not sure who builds those antibodies, how long those antibodies last. The idea would be that some of that would give some protection to a potential new strain. But again, all of this is being looked at in detail, both by those who are developing the vaccines and the virologists who are looking at the data.
And what significant difference will the new Oxford vaccine make coming online?
Absolutely, it's going to be really helpful once that's approved, because it's something that can be, the Oxford vaccine doesn't have to be stored at super low temperatures, so it can be both transported much more easily and given, so especially in the community, for our community homes, for our housebound patients, but also for the primary care hubs that once you just saw in the images, it can be delivered there much more easily to deliver the vaccine. So it will be helpful in terms of the speed and the amount of vaccines that we can deliver.
It will, of course, offer the element of choice for people. Do you see that as a problem with people deciding that they want one vaccine over another?
Absolutely, and we've discussed this even with our colleagues at Independent Sage, and we know that there's so much information going about, which is great, but it does provide patient choice, and that is a difficult one because these hubs will only be provided with the vaccines that they get delivered to them. There is information out there on the efficacy of all these different vaccines. And really what we need is a central campaign to the public to say, look, all the vaccines have been approved, they're safe, and please accept the vaccine that you're delivered, because that is something that would add extra workload on the ground, both when we're booking in patients and when patients present, and offering them a choice, which I just don't think is feasible considering the numbers we need to vaccinate.
So basically take whatever you are offered. Dr. Patel, thank you very much for sharing your expertise with us this morning. Thank you.
Many thanks.